I'm Dr. Greg Rose. I'm the Medical Director of Infection Prevention and Control at the Queensway Carleton Hospital. Unfortunately, Ottawa has seen its first cases of measles in several years. Here's what you need to know. Everyone's heard of measles, but not everybody is aware of what it is. Measles used to be one of the most common infectious diseases in the world. It's a viral infection that can be associated with rash, fevers, and some severe complications. It's one of the most contagious diseases known to humanity. Measles is spread by an airborne route, meaning that if somebody is sick with measles, they're actually breathing the virus out into the air around them. And people typically will pick up measles by breathing in that contaminated air. It is also possible, however, to get measles from touching open measles sores on the skin. If you are not immune to measles and you've been exposed to it, there is about a 90% chance that you will become sick with it. You're also potentially contagious with measles up to 4 days before you first develop symptoms. Typically, if somebody has been exposed to measles, within about a week, they will start to develop symptoms, which usually start with red eyes, runny nose, and a cough, a few days before they start to develop a rash, which starts on the head and neck and spreads downwards. If you think you have symptoms of measles, high fever, red eyes, runny nose, cough, and rash, it is extremely important that you be assessed by a health professional as soon as possible. But unfortunately, because measles is so contagious and because it spreads through the air, not all clinics are able to assess people safely when they have measles. It's very important that before you present to a doctor, a nurse practitioner, or an emergency room to be assessed, you call ahead to make sure that they have space to be able to see you safely. About 1 in 4 people who develop measles will require hospitalization. About 1 in 10 people who develop measles will develop infection in their ear or in their lungs. 1 in 1,000 people will develop inflammation of their brain called encephalitis. There's also a very severe late complication, which is happily very rare, called subacute sclerosing panencephalitis, which can happen up to 10 years after being sick with measles and causes a type of brain inflammation. This is why it's so important to make sure that we are doing everything we can to control the spread of this infection. The most important thing that you can do to prevent yourself and your loved ones from getting measles is to get vaccinated. A single dose of measles vaccine is effective at preventing 90 to 93% of cases of measles. 2 doses of vaccine is close to 100% effective in preventing measles. It is most important that the most vulnerable members of our community be vaccinated. And that is typically children at around 12 months of age. If you do not know what your vaccine status is, please speak to your doctor or your nurse practitioner. And if there's any doubt, get another dose of the vaccine.